So now we're going to see about the signs, symptoms, and pre-hospital treatment of open pneumothorax. Open pneumothorax resulted after chest trauma when the pleural cavity is exposed to the atmospheric air and when air is accumulated to the pleural space. While we are looking at the signs and symptoms, the first one is shortness of breath. Since the affected side is not working adequately, the patient will feel air hunger and difficulty of breathing, and we call it this like shortness of breath. Since there is a trauma on the chest and there is a wound, the patient will feel pain while the patient is during inspiration and expiration. The presence of sucking or gargling sounds as the air moves in and out of the pleural cavity during inspiration and expiration, this will be a pertinent finding to diagnose open pneumothorax. And this type of sucking or gargling sounds during expiration and inspiration is called like sucking chest wound. As you see the picture below, there is a visible wound on the anterior part of the chest. While you're noticing such kind of wound, and especially when the wound is sucking type, the probability of open pneumothorax will be very high. When we are looking at this picture, when the patient inhales, air will be entered from the outside, which means from the atmosphere to the pleural cavity, and also the air will leak or release from the lung cavity. So every time the patient inhales, this accumulated air, because of entrance of the air from the atmospheric area and from the leakage of the air from the lung, will become greater and higher. And this accumulated air will collapse or compress the lung tissue, and it will furtherly deviate and compress the mediastinal tissue to the unaffected side, and the situation become more compromised. Let's see the pre-hospital treatment for the open pneumothorax. Temporarily, closing the chest wound by applying direct pressure with our gloved hand will be the solution, because this will temporarily close the entrance of the air from the outside to the pleural cavity. But applying occlusive bracing using dressing foil or plastic bandage type will be necessary. The dressing will be like this. This picture shows this three-sided sealing, because this three-sided sealing will prevent the entrance of the air from the outside to the pleural cavity during inspiration. But this left part will allow the leakage or the release of accumulated air from the pleural cavity to the outside. If you close all of this, there is no place for the air leakage or the release from the accumulated air to the outside. So you may complicate the situation from open pneumothorax to tension pneumothorax. After you are applying the three-sided sealing, and if the patient develops severe respiratory distress like severe dyspnea, you have to remove the dressing immediately, because as you see the picture here, every time the patient inhales, the air will be released through this inside lung opening to the pleural cavity, and the air will be accumulated over here. If you apply the sealing completely, there is no any place for releasing or for the leakage from the inside to the outside. So if the patient experiences severe dyspnea, you have to remove the sealing and you have to allow temporary relief for the tension. Providing ventilatory support with high concentration oxygen is also mandatory, and you have to monitor the oxygen saturation with capnography and pulse oximetry. Establishing vascular access is also beneficiary, because not only for open pneumothorax patients, not only for chest trauma patients, for any patients coming with the trauma, establishing vascular access is very advisable, because the patient may need fluid or blood resuscitation in near future. Open pneumothorax is a life-threatening situation and the patient is critical, so establishing the patient to rapid transport for appropriate care is also mandatory. This is all about pre-hospital treatment of open pneumothorax and the signs and symptoms. Thank you for listening.